Mark Ruffalo's Hulk is smashing his way into Spider-Man, Brand New Day. Mark Ruffalo, the actor behind the Hulk, will reprise his role in the upcoming Spider-Man, Brand New Day, slated for July 2026. This is a surprising addition, given the film's reported focus on a more grounded story for Tom Holland's Spider-Man, following the reality-bending events of his previous appearances. The inclusion of the Hulk alongside the return of John Bernthal's Punisher raises questions about the film's plot. Even with the confirmed return of Michael Mondo as Scorpion, the overall narrative remains largely unclear. Ruffalo's casting could be interpreted as a continuation of the theme of Peter Parker seeking father figures among the established MCU heroes. However, it also highlights the challenge the MCU faces in balancing introducing new characters while retaining established ones, particularly given the upcoming Avengers, Doomsday film. The timing of Spider-Man, Brand New Day, as the last Marvel film before Avengers, Doomsday, adds further complexity to how the Hulk and Spider-Man's storylines will intertwine within the broader MCU narrative.
In our next story, Sydney Sweeney jeans ad company American Eagle addresses partisan uproar. American Eagle's recent ad campaign featuring actress Sydney Sweeney has sparked an unexpected controversy. Conservative media outlets and figures like Vice President J.D. Vance seized on a line in the ad mentioning jeans, twisting it into an accusation of promoting eugenics. This interpretation was amplified on social media, despite a lack of evidence supporting such claims. American Eagle has since released a statement clarifying that the ad was simply about the jeans themselves, celebrating how people wear them with confidence. The company emphasized that the campaign's focus was Sweeney's personal style and the product, not a broader social or political message. Despite the company's clarification, the controversy continues. VP Vance and others have used the perceived outrage to criticize Democrats, claiming the reaction is an example of excessive political correctness. However, no major Democratic figures have actually publicly commented on the advertisement. The incident highlights the ease with which online discussions can be manipulated and amplified, transforming a simple clothing ad into a political battleground. The controversy underscores the power of social media to create and disseminate misinformation, regardless of factual basis.
In our next story, under RFK Jr., CDC skips study on vaccination rates, quietly posts data on drop. National kindergartner vaccination rates have dipped again, falling from 92.7% MMR coverage in 2023-2024 to 92.5% this past school year. While the decrease seems small, it translates to thousands of unvaccinated children and continues a worrying downward trend, increasing the risk of outbreaks. This leaves an estimated 286,000 young children unprotected against measles, a disease declared eliminated in 2000. Measles cases in 2025 are already higher than any year since then, reaching a 33-year high. This decline follows a broader trend. MMR vaccination rates have fallen from 95% in 2019-2020 to the current level. Health experts consider 95% coverage crucial to prevent community spread. While pandemic-related disruptions initially impacted vaccination access, the ongoing decline is increasingly linked to anti-vaccine sentiment and misinformation. Non-medical exemptions for childhood vaccinations have reached a new peak this year, fueled by the influence of anti-vaccine voices. The rise of anti-vaccine rhetoric, including from prominent figures like Health Secretary Robert F. Kennedy Jr., is exacerbating this dangerous trend, jeopardizing the nation's progress in eradicating preventable childhood diseases.
In our next story, 4 dead in shooting at Montana bar, suspect at large, Highway Patrol. A mass shooting at the Owl Bar in Anaconda, Montana, has left 4 people dead. The suspect, 45-year-old Michael Paul Brown, remains at large and is considered armed and dangerous. Authorities are urging the public to exercise caution. Brown is described as driving a 2007 white Ford F-150 pickup truck with Montana license plates. The motive for the shooting is currently unknown and under investigation. Montana Governor Greg Gianforte has publicly acknowledged the incident and stated he's closely monitoring the situation. Law enforcement agencies across the region are actively involved in the search for Brown. This is an ongoing investigation, and further details will be released as they become available. Anyone with information is urged to contact authorities immediately.
In our next story, dirty habit followed by 18 million Americans triples the risk of getting cancer. A new study reveals a significant link between frequent marijuana use and oral cancer. Researchers at UC San Diego, followed nearly 45,000 individuals for 5 years, finding that daily marijuana smokers were over 3 times more likely to develop oral cancer than non-users. This increased risk is attributed to the presence of carcinogens in cannabis smoke, similar to those found in tobacco, which damage mouth tissues and suppress the immune system's ability to fight cancerous cells. The study highlighted that individuals with cannabis use disorder, CUD, showed a substantially higher rate of oral cancer, 0.74% compared to those without CUD, 0.23%. This risk further escalated for those with CUD who also use tobacco, reaching a 6.24 times higher likelihood of developing oral cancer. Age also proved to be a significant factor, with each additional year increasing the risk. These findings underscore the potential long-term health consequences of chronic marijuana use, particularly concerning oral health. The researchers suggest that these results should inform cancer screening practices in primary care and mental health settings. Given the overlap in risk factors among individuals with CUD, the study emphasizes the importance of considering the potential dangers of marijuana, even independent of tobacco use. The study's implications extend beyond oral cancer, with previous research linking marijuana use to increased risks of cardiovascular disease, liver damage, and mental health issues like schizophrenia, especially among adolescents and those using high-potency cannabis. These cumulative findings highlight the need for continued research and public awareness regarding the potential health risks associated with